I remember a great story about a volunteer who was complaining to the executive director of the organization that this woman had come in. She had driven up in a BMW station wagon and she was wearing fairly nice clothes and she was carrying a designer handbag. The volunteer said, "Why is this woman getting free food from us?" This woman was the victim of domestic violence. Her husband had taken every liquid asset away from her. She had no cash. And she was not close to any kind of transportation. So she needed that to get her kids to school and to healthcare and whatever else. And the designer handbag she had picked up at a local clothing place where people were donating nice clothing. She said, "I knew it was a nice bag and I got it for nothing." The vast majority of people who use food pantries only use them transitionally in their lifetime.
Welcome to the Pioneers of Possibility podcast. I'm your host, Kareem Afzal, and I'm really thrilled today to be graced here with our guest, Russell Johnson, the former CEO of the HealthSpark Foundation in southeastern Pennsylvania. Russ, welcome.
Thank you very much. Great to see you again.
So tell us a little bit about, just briefly, what the foundation does and did during your time there.
Sure. So the foundation continued the legacy of a local hospital, nonprofit hospital, which was sold to a for-profit company, creating an endowment. And that hospital had always sought to serve the local community. And members of the foundation's board came from the former hospital. And then there were a few other people that they added on. And they were kind of looking to see, okay, so what can we do? And what's the community's need? And what is the role of the foundation in addressing that need? So my early days at the foundation were really going out and meeting nonprofit leaders in the community and learning about their work and what their needs were and how they were addressing those needs. And one of the things that I found in probably more than 36 interviews was a couple of things. Hardworking, dedicated people, under-resourced pretty much across the board, different business models, different legacies and connections with the community. But when I got down to how do you run your business? Not one of them had a strategic plan or a business plan to implement it. And that was curious to me because I thought, most of my experience was putting together annual plans, putting together communication messages to the community about where were our priorities, how were we choosing to address those things, talking to the community about what their preferences were and how they wanted to be served. And these organizations really didn't do that in any formal way. So I went back to my board and said, I think that what we really should consider here is trying to build a better business model for these folks. The other thing that was really shocking to me was that most of the nonprofits that I talked to thought a $5,000 grant was a big grant.
You got here in your own way, right? So let's go back to your early days.
I was raised in a pretty middle-class community in Montgomery County,
which is southeastern Pennsylvania.
Right. So we enjoyed, a pretty nice growing up experience. But I always wanted to be a doctor. So I had this kind of helping people mindset from a really early age. Went off to undergraduate education at Muhlenberg College in Allentown, started out in pre-med and bombed out in the first semester. I really kind of messed around a while at college, different majors, different, exposing myself, which, as I said to you a little bit earlier today, is, when you're 20 years old, you really don't have to decide what you want to do for the rest of your life. And I'm a living example of, changing careers a couple times along the way. But I did end up in social work and started my employment history, working for a public child welfare agency. And I was there for about 17 years.
And what did you do there?
So initially, I was a graduate student there for 2 years. And then I got hired and I had two tracks. One was policy, and
Okay.
that was groundbreaking at the time. Nobody really looked at policy.
You were researching policy.
So I wasn't researching policy as much as I was trying to figure out what policies the organization should be embracing. And how do you create a business model, which I didn't even think about it in those terms in those days, but how do you do your job? And how do you stay accountable? In that case, we were a public county agency. So our bosses were elected officials. And, politics always even then played some role in what we did and how we went about doing it. So having a clarity of policy was really important. The other thing was more on the clinical side, there were an increasing number of adolescent kids who were being brought to the attention of the Public Child Welfare Agency. Some of it had to do with child truancy, school truancy, but a lot of it had to do with acting out behaviors in the home. And so we developed a clinical program at the agency to really look at what those needs of those kids were, what were the resources in the community to address those needs, and how do we mentor those. And so we started to invest in the community through contracts that we made with other nonprofit organizations to run programs and services that were designed to address the needs of those adolescent kids. That was fun.
So what would you say is a shining example of your work?
Shining example, I think collaboration across the platforms of the county agencies was probably one of those things. And again, backed into it, didn't go in with the shining North Star that said, this is what I'm doing. It was, really kind of through the day-to-day work that we realized the intersections of public education, behavioral health, substance use disorders, in a couple of instances, even aging and adult services, because there were grandparents involved in the lives of these kids. And they were fragile people themselves. And so looking at how the county's resources could be designed in such a way that we engaged a family as a county service provider instead of 5 county service providers with 5 social workers and 5 service plans and 5 meeting schedules. And it just was insane. But that's how we worked in those days. So kind of thinking about that transformational engagement process was pretty neat.
And this is it's really a through line for your career in life, right? So it's in my experience in working with you, Russ, from my time in Man on Main Street and in the community of Montgomery County is where is the intersectionality of service providing that this organization doesn't overlap this organization to provide the best outcome for a particular community and group of people.
So I'll tell you a philanthropic story.
Okay.
And one of the banes of existence of foundation staff is organizations who write unsolicited letters of inquiry to foundations that say, we do really important work in the community and we know that you have money and we'd like you to give some of your money to us because we're really a great organization. And so that sparks a conversation. And, one of the first things that a foundation person would ask is, what's your mission? And how well are you accomplishing your mission? And how does your request fit in that mission? And there was the rub. Because oftentimes the requests had nothing to do with the mission. They had to do with the perception that the foundation had a lot of money and that the nonprofit should be a beneficiary of that money. And there was this implicit expectation that the foundation should just trust the nonprofit to do good stuff. But they really couldn't tell you what the good stuff was.
These were general operating grants that folks were coming to you for, or just random programs that they wanted?
Random programs. And so another term got coined in our industry, and that's mission creep. And mission creep, broadly defined, is you were set up to do something. And over a period of time, you either accomplished and did that really well and saw other opportunity, or you didn't see other opportunity, but you needed more money to do what you were doing. And the only way that you saw of getting that extra money was to tell people you would do other things that were aligned with what they would give you.
So, but we'll go from child services to your next stop and sort of the circumstances that got you to the foundation.
So from children's services, the last couple of years were focused really on automation. So we were moving from the era of selectric typewriters, which I'm not even sure that some of your community will even know what those things are, but they were smart typewriters. And so I designed the programmatic side of that computer application. And ultimately, it was a pretty successful project. And the company that was partnering with the county hired me. And so I left the county and went to work with them and bring that solution to other public child welfare agencies, behavioral health agencies, drug and alcohol agencies, information and referral agencies, and aging agencies across the Commonwealth of Pennsylvania. So I did that for a few years, and then that company evolved, had the honor of being hired to work at the Pew Charitable Trusts, in their largest grant-making program, which was Health and Human Services. And my portfolio was a national portfolio that was focused on managed care and people with disabilities. So I did grant making across the country, which was a whole new experience for me, working for a national funder who had a whole new world of thinking about philanthropy.
And how many years were you at Pew?
About 5.
5 years.
But one of the things that I had to do, we had 5 people in our department, and we were the department that got the most unsolicited proposals. And we got about 75 to 150 a week.
A week?
A week.
So when you get an unsolicited proposal, and at your time at Pew and also at HealthSpark, which was the North Penn Community Health Foundation before it was HealthSpark, did you feel responsible for responding to every unsolicited proposal that would come in the door?
We felt that we needed to have transparency to our operation. We needed to help people understand what our board was interested in accomplishing in the community. So at Pew, with 75 to 150 unsolicited proposals a week, that got very automated.
Okay.
So we had to learn how to be efficient because you couldn't possibly read 150 proposals.
But and for our audience, these proposals are multi-page.
Oh my goodness.
Complex proposals.
Some of them were 2 or 3 inches thick.
2 or 3 inches thick. Okay.
Others of them were just letters of inquiry. And my boss had crafted about 40 some reasons why we would not consider a proposal. And so I just had a big rubber stamp.
The big red rubber stamp.
Big rubber stamp on the proposal. I put the code in that aligned with the reason that we were turning it down. It went to grants administration. My boss got a letter at the end of the week that said, "Thank you very much, but no, we're not moving this forward." And then I would go on to the next 150.
Is there a grant that you would say stood out that you made that provided the most impact to your area?
The late 80s, early 90s.
Yeah.
We were doing some real transformative work because managed care was just a concept that hadn't been proven. One of the populations of people considered with a disability was the HIV/AIDS population. So there was this really interesting group up in Boston who was looking at the cost of care for end of life for patients with HIV/AIDS. And working in partnership with Robert Wood Johnson Foundation, who co-funded this effort, we really were able to do a number of things. We were able to improve the quality of life for those patients who were terminally ill. We were able to improve the satisfaction of the caregivers who were rendering services and improve the safety for both the patient and the providers in rendering care. We were able to reduce the cost of care, which was hugely important because almost all of those patients were being supported with taxpayer dollars.
And you were able to reduce that by a very significant amount.
A very significant amount. The last 6 months of life for the folks who were not participating in the project cost 4 times more than the cost of care for the people who participated in the project. Plus, the people who were in the project lived significantly longer in their own homes, in their own communities, surrounded by loved ones. and where the community was collaborating around how to meet the needs of those patients in end of life.
People age with end of life care in their homes in a more dignified, they have better outcomes, they live longer, and they pass with dignity in a way that is much more challenged in a medical setting.
So what I really learned, from that project and a couple of others that I was involved with at Pew was collaboration amongst caregivers really adds value to the patient and the patient's family because they're experiencing a crisis in their life. And the last thing that they need is more complication, more regimen, more paperwork, more visits, more of all the things. They wanted coordination, they wanted quality of life, they wanted good outcomes, and they wanted it to be affordable. When I left Pew, I went to work for a huge, big national company in managed behavioral health care and ended up shortly after I took that job, moving from a national account perspective to the Commonwealth of Pennsylvania. That was my, one of two for-profit experiences in my career, and really looking at trying to be this person who was concerned about other human beings, but also concerned about the bottom line, because if I didn't meet that, I didn't get paid.
And then you got the opportunity for the foundation.
I did. I was serving as the chair of a board in a Philadelphia nonprofit organization.
And then what did you do? How did you think about engaging these organizations, right? Because organizations, I'm serving the community, I'm doing incredible work. I don't need somebody from the outside to come in and tell me how to run my show and how to support or feed my clients. How did you manage that really delicate relationship in the early going?
So it was a careful dance, to be sure. And lo and behold, the board and the former executive had lost sight of basic accounting, and they had issued award letters to some 40 organizations in the community, and realized after the award letters were sent out, which, by the way, many of those organizations then took to lenders and got guarantees against those letters so that they could advance lines of credit. Okay. The United Way realized that they had insufficient funds to cover the cost of those award letters. Those award letters are contracts, by the way. So these are legally binding documents.
And of those 40 award letters, what numbers are we talking about?
Hundreds of thousands of dollars. So the United Way board, North Penn Community Health Foundation board, me and this board member who was the accountant came together for a couple of meetings, and we said, look, the foundation really hasn't started working in the community yet. But we have money, and we can probably help most of the people who got these award letters to be made whole. But my board said to me, so what's in it for us other than goodwill? And I said, so maybe we have the opportunity to engage these folks and learn how all of this happened. And so two things happened. One is we partnered with the United Way, made friends with them, and made whole all the organizations who were not going to get the money. The other thing that we did was gain their support to encourage their grantee organizations to participate in something that the foundation started, which was called the Nonprofit Academy. And the Nonprofit Academy was designed to help enhance business acumen amongst the board and executive leadership of all these nonprofits. Because at the end of the day, we realized this was a partnership between the United Way and all these nonprofits and the community, and there had been a breakdown in understanding. And so we wanted to figure out how to prevent that from ever happening again. So we partnered with a local university and developed a curriculum, and we had about 40 organizations participate in that initial year. And so it was somewhat successful, but it wasn't a home run. It was too much, too fast for a lot of these organizations. And at the end of the first year, not one of them had written a business plan or a strategic plan, which was the goal.
And what would you say? What would you say is attributable to that? People go back to the organizations and just get busy with the way they had been doing things.
I think that there was a lot of pressure on these organizations to continue to deliver, and they were struggling, a lot of them financially. Most of the staff in these organizations was not paid a fair living wage. Um, there was an increasing demand for services where there wasn't really capacity to do more. We hired a consultant who, interestingly, in the community where you live and work, that person is now the CEO of another foundation that evolved over time. And we started to bring in nationally recognized experts in particular areas. So fundraising, volunteer program development, business planning, um, staff development, all kinds of areas like that where there was good resource. There was strong evidence that if you followed the model, you could get the outcome. What was interesting in our community was people loved the models but weren't willing to follow them protocol. So they home grew their own implementation plans. And in most instances, they failed because it wasn't the model. And I think it took many years, I think, for people to finally realize that if you want to implement an evidence-based tool, it requires evaluation and rigor.
I would say working with you, one of your gifts is to challenge organizations in order to hone in on their mission, right? So we've talked about that up until now.
Yeah.
And just to give the audience a bit of an experiential how this worked in practice, I was traveling for my work. I was the board member of Man on Main Street, which is an organization dedicated to food insecurity as a broad term. And I was talking with one of the founding executive directors, and I was in Turkey. He was in the United States. He had just had a conversation with Russ about rethinking through our the way we're delivering services to be more food centric, because at the particular moment in time in our history, we were doing a bunch of other ancillary programs that we felt we were very good at, but Russ wanted to challenge us in our business model to focus more holistically on food that would enable us to grow our programs by 3, 4, whatever times. How did you find, not necessarily talking about manna, but you would challenge different organizations in this way throughout our community?
The level of sophistication and understanding about that was all over the map. North Bend Community Health Foundation hired a program officer. We decided this should be a learning community. So come and tell us what your challenges are, where your food comes from, how you distribute the food, what is the model, what does it cost you to do business, where do you get your refrigerators and freezers, how do you pay for them, how do you keep them clean, all of that kind of nitty-gritty stuff. And over time, that group grew from a core of about 15 organizations to almost 45. What they understood was that the vast majority of people who use food pantries only use them transitionally in their lifetime.
Especially in the suburban setting in which we are.
So there are people who are permanently disabled. There are older people who are frail and whose life circumstances are never going to change. And they're the consistent consumers, but they only represent 10 to 15% of the population who use those food pantries. So the vast majority of people are there because there was an illness or a death in the family. The breadwinner, died or left. There was some domestic violence in the family. There was tragedy in a variety of different ways. But people lost their life savings. They lost their safety net. And now they're dependent on the community. And so the question was, how do these food pantries respond to that need? And initially, the model was we have church-based volunteers who come and they gather food from a program at the church. People bring in groceries and sort them out and whatever. And then other volunteers would pre-pack grocery bags of food, and you would come as a family in need, and you would be given a number of grocery bags depending on the size of your household. There was no understanding about what your food preferences are, whether you had any physical condition that prevented you from eating some of the food that was in that bag, whether you had any lifestyle or religious.
You got the bag they were giving you.
You got the bag.
Whether you could eat it or not.
Yes. Whether you could eat it or not. And, the bag came with an attitude of the people that said you should be grateful for what you get. So when people would
thank me for feeding you.
Yeah. And if people unpacked the bag and left things behind, you were ungrateful. I remember a great story about a volunteer who was complaining to the executive director of the organization, not Manna, that this woman had come in and she had driven up in a BMW station wagon, and it was an older car, and she was wearing some fairly nice clothes, and she was carrying a designer handbag. The volunteer said, "Why is this woman getting free food from us? She's clearly ripping us off." The story is just so poignant because this woman was the victim of domestic violence. Her husband had taken every liquid asset away from her. She had no cash. She had a car because he had bought it, but it was her only way of getting from her home, which she still had to live in, although she was at risk of losing that because she couldn't pay the taxes. And she was not close to any kind of transportation. So she needed that to get her kids to school and to healthcare and whatever else. And the designer handbag she had picked up at a local clothing place where people were donating nice clothing. She said, "I knew it was a nice bag and I got it for nothing." That triggered a whole nother activity that the foundation hosted, which was training for all the volunteers about who their customers were.
Suburban financial insecurity as a whole is very different than urban, right? Yeah. So where multiple parents are working in the household and one parent happens to lose a job, and families have to either pay for the roof over their head, make a choice to go to a food pantry for supplemental food. It is almost more of a hidden story that the foundation and the organizations within this community have really done an increasingly good job at educating their volunteers, educating themselves to understand those hidden challenges. Mission-driven businesses, right? So, and when we first had that discussion, you and I, that these are organizations that employ people who are spending money in the community, they live in the community, they're paying taxes in the community, they're serving clients who are also doing the same thing, and that their model of delivery of services should be in a financially sustainable way. And as we talked about your early career, you have a lot of the through lines in organizing organizations and nonprofits and people according to that. So I just like you to talk about that a little bit.
From a taxpayer perspective, and talk about the IRS, households file their annual tax return, right? And you pay taxes based on the amount of money that you make. And similarly, businesses do that. Nonprofits don't file tax returns. And so there was this mentality in the community that just was really confounding to me, that we're a charity. And as a charity, we should be frugal, and we should really constrain anything that is not necessary to carry out our work. And so how that translated in the community was not a lot of training for either volunteers or staff or board members Uh, Board members in particular, a lot of them were recruited onto boards because of their business acumen. But what was really interesting to me is they seemed to park it at the door when they went through the nonprofit meeting room. And they took on this persona of can't spend any money, we can't invest in anything, we're not allowed to make a profit. Well, that was really silly. We don't call it profit in nonprofit world, we call it retained earnings. It's profit, call it what you want it. It's money that's in the bank at the end of the day. And a healthy nonprofit should have retained earnings of 2 to 3% of its annual budget because they need that money to invest in their infrastructure, which is not only their building and their grounds, but also their people. And also keeping up with what is the current way in which the community's needs manifest themselves and how to effectively provide service to meet those needs. You need investment money for that. Foundations can provide some of that investment money, but businesses should be investing in themselves.
As nonprofits grow, and in order to retain your talent, staff wants to grow. They want to be trained well, they want to have resources to do their job, and they want to be paid a living wage.
Yeah.
And that's something that, as the nonprofit community continues to evolve and grow, it's something that even at our foundation, we are investing in order to mature this sector. Is something that's absolutely critical to the growth of our nation and the evolution. We could really talk about this a long time. North Penn Commons. So it's one of the larger projects, I would say, that our community has had. The coming together of 4 nonprofits, United Way, Man on Main Street, the Food Insecurity, Peak Center, which was the day center for seniors, and Advanced Living Communities, which was an affordable housing operator and developer. In a lot of ways, you're, I don't want to say bearing trust, it's not really a respectful word, but it's your vision brought these organizations together.
All 4 of those organizations had not done a great job of building operating capital. And yet a couple of them had really taken seriously this notion of collaboration and partnering in the community and recognizing that the people that they were serving were also being served by one or more of those 4 partners. All 4 of those organizations had come to the foundation in one way or another and let us know that they were interested in expanding. And in particular, they were looking for new physical plants.
So each one was about to embark on a capital campaign.
And, some of them were a little bit further down the road than others. One of them had actually done a feasibility study about raising capital money and had gone and worked with an architect and had this vision plan of this campus and whole thing. I had done some facility projects in my past and knew that it's cheaper to build 4 walls and put things inside those 4 walls than it is to build 4 times those 4 walls. So I remember just before Christmas, we had a lunch foundation hosted, and I invited the 4 organizations to come. And I said to them, I'm baffled by what your visions are here, because I just don't see how the community is going to have the resources that you're expecting it to give to you to do these 4 projects independently. And would you have any interest in exploring, at the foundation's expense, a collaborative project? And, I think that foundations wield an inordinate amount of power. There's a power paradigm where people are always afraid to say no to a foundation, you'll never be
funded again
back. And so I think these 4 folks, were playing that game to say, Russ has an idea here. Let's just let him go with it. He's paying for it. We'll give him a little bit of time and he'll go away because he'll know that this doesn't work. But what we did was we hired a business developer. We ultimately presented to a combined afternoon and dinner meeting attended by the 4 boards of directors of the organizations and their leadership teams.
I was there at that
and
event.
the four leaders stood in front of this audience and said, here's what our program does, and here's how we envision partnering with these other three, and here's how our community could be better served if we did this. What ultimately evolved was a capital campaign that the foundation paid for the consultant to run. The project itself was a $30 million project, and the $30 million was rehabbing the existing campus where the YMCA was located and operating its current programs, building 60 units of affordable housing, building on the ground floor underneath that affordable housing, a new manor on Main Street and a new senior center, and connecting all of that to the existing YMCA with a huge shared space. The state talked about this project for years after they funded it because it was such a model. So I want to say something about the lobby, and that was that we had...
There's a lot of discussion on the lobby.
There was a huge amount of discussion on the lobby because the YMCA was a family-based organization, and no one really perceived the YMCA as providing any services to people in need. This was a recreational and socialization kind of nonprofit organization to grow character and to strengthen families. And they're co-located now with tenants in 60 units of affordable housing, and they're all people aged 60 and older, low income, and many with disabilities. On top of that, there was the senior center, which served a cohort of people 55 plus, many of whom were low income, many of whom had experienced tragedy at the end of their adult lives and were in need of supports in the community. And then there was Manor on Main Street, which was providing not only soup kitchen services, but also a food pantry program that had evolved into a best practice food pantry model.
It's a choice model system.
Choice model system. And what that means is that people ordered online before coming into the pantry, went in and shopped like most of us shop in a local grocery store. You push a cart through, you take things off the shelf, you check out, and you go home. But we didn't want anyone to be stigmatized by coming to North Penn Commons. So entering through the lobby, you had no clue why someone was there.
We had this discussion
multiple times.
A lot. That stigma-free environment was absolutely important to our customers, right? Mana's customers. I'm speaking for myself as a former board chair. That stigma-free environment. It's hard enough for somebody to come to a pantry and a soup kitchen when you need supplemental food, period.
Right.
And being in this new, shiny, kind of literal city on the hill, so to speak, where we were in Lansdale, it was really important for us as an organization and that service delivery to our clients that we had one door, not a side door.
And no stigma.
And no stigma. So for our listeners, you could listen to the podcast with Susan Niger-Gould, the executive director of Manna on Main Street, to learn about our expansion of services that Manna has delivered to a broader area and the increased need that we've seen over the last few years, especially at the introduction of COVID. And I'll get to sort of this general time frame as sort of our last topic here. As the foundation evolved and grew, towards the end of your tenure, there was I would say I wouldn't say new, but a renewed definitive focus on justice, equity, and specifically Black justice and equity. Tell me about how the board and how the foundation, I wouldn't say repurposed or realigned itself, but really made this a huge part of their focus.
We were looking at trying to connect with the entire county community and trying to understand how the needs and challenges of people who were living in Montgomery County, again, an extraordinarily wealthy community that masked the challenges of living in poverty, how we could do a better job. And so as we began to understand that all these folks were living in the community we also began to understand that the nonprofit world was not reaching into those newer community populations and did not have a clear understanding about how to address the needs of the people in those communities. So we did a lot of convening. We brought people together. Some communities said, look, we want to just develop our own program and we only want to serve our own people. And we had advisors tell us that that was short-sighted and we shouldn't go down that road. And so my board made a very conscious decision that Montgomery County should continue to be inviting to everybody and that the program should be inviting to all participants and not just focused on one particular group. We started a Black Justice Fund to engage with communities of color who were doing important work, but who were not coming to the foundation for support, who were not attending foundation activities, and who were not partnering with many of the foundation's key philanthropic partners. And so that Black Justice Fund was really meant to do two things. One was to introduce the notion of philanthropy into the community and to help break down barriers that people in the communities of color perceive as barriers to getting foundation dollars. So we hired people of color to work on the staff, again, as a visible expression of commitment to having a place at the table. And our staff was, very, very small, but really did a heck of a lift to really engage with people who were fearful of coming to the community foundation, fearful of being honest with us, fearful of opening their own stories to us, fearful of judgment. And it took 2 rounds of grant making to really kind of begin to break down those barriers. But once they started to get eroded, we found a whole second generation of folks. And that's when the Hispanic community, and then to some extent, other communities of color, broadly defined, started to come to the foundation and started to say, well, it's not just Black justice, it's justice for all. And how can we contribute to the quality of enhancing the quality of life and opportunity in this community for everybody?
This community that we're talking specifically, significant African American population, significant Korean American population, significant South Asian population, defined as Bangladeshi, India, Pakistan population, very significant Latino community,
Vietnamese,
Nepalese. It's a very diverse. It's almost eclectically diverse in comparison to other suburban centers who are similar to us. As we wrap up, I want you to think about your single biggest learning that you would say throughout your career that you want our listeners to take with them, that enabled your success and enabled the foundation's success to reach so many people and change so many lives.
The ability to listen and to always ask questions, because your lived experience is just that. You know what you know, you don't know what you don't know. And so pushing the boundaries and going and visiting people who don't look like me, who don't have the same background, was uncomfortable for sure, especially at the beginning. And yet I found the majority of experiences to be ones where people were willing to have a conversation. Not always, right out there at the beginning, but willing to risk, as I was, just showing my humanity a little bit, asking a question about how we could understand each other better, what you could bring to the table, what I could bring to the table. And the other thing that comes with listening was the understanding of the power dynamic. So if you remember, my beginning career was working for county government. There isn't much more power than sits with the local government. And when you work for the Public Child Welfare Agency and you come knocking on somebody's door who's having a lot of family breakdown, your biggest concern is that the government's going to take your kid away. And that was always part of that business paradigm. And I really wasn't there to take the kid away. I was there to strengthen families. But that's not what they saw. That's not what they heard.
Russ, I really want to thank you for sharing that, because in this moment in time, where September 25th, 2025, that power of active listening to those who don't look like you, agree with you, don't come from the same background, especially in American society, is something that I hope all of our listeners will take to heart and enable us to grow as a people and a nation. So with that, Russ, I want to thank you for being on the show. And thank you for all of your contributions to all of the organizations and folks that you have in front of them and behind the scenes help change their lives. Thank you very much, Russ.
Well, thanks for coming 2,800 miles to visit.
This show's been produced by Danny Vagnoni, with music created and written by the artist known as Sahari, with artwork produced by Layla Afzal. I'm your host, Kareem Afzal. See you next time.
And all your lights are on the appropriate colors.
Yeah, no, these don't do anything, right?
I'm just messing with you. Or you haven't learned how to do them right yet.
I haven't learned, if I wanted to go or like do, you could program those to.
Yeah, my grandson has little things that do that too.
Oh, that's great.